Hi, everyone. It's Brad Keats from Canada Health Infoway. Welcome to our webinar talking about a toolkit for implementers of artificial intelligence in healthcare. This is a webinar that's in support of a toolkit we've developed. You can see some of the links on the screen here, both a QR code and a link. If we can move to the next slide, please. This is the fifth of 5 webinars we've put together in support of the toolkit. For those of you who have been with us through the entire journey, thank you very much. For those of you who are just joining, this is a jam-packed webinar. We're likely going to go right to the top of the hour with content. We will have time for a few questions. I'm also hoping that you can just take a moment right now and just look at the little poll we have on the right-hand side. We're trying to make sure we understand who the audience is, and we'll see if we can tune some of our content for that as we're going along. Can we move to the next slide? This webinar is also available in French translation. You should be able to hit the translation button on your Zoom screen and follow it from there. If you're listening in English, nothing is required from you, so that would be great. Just as a comment here, a lot of the topics that we are discussing, especially in the governance side, which will show up today, they may sound a little bit legal or legalistic, but we're not offering any particular legal advice on it, but it's good background as we're moving through. And if we can move to the next slide, without any further ado, I'd like to introduce Carol. She's been our speaker through all 5 of the webinars. She was totally instrumental in helping develop the toolkit. She's been a great partner to Infoway and the groups that we've been working with. And without anything more, let me turn it over to Carol. And Carol, thanks a lot for helping out again today.
Thank you. Thank you for having me again on this. This is the 5th webinar that we've put on that really goes through and unpacks different parts of the toolkit. So just as a reminder, for those who have been on this journey with us, but also for those who are new to this webinar series, this has been, the toolkit was really put in place with a target audience of helping all kinds of people in the health sector, whether you're at teaching hospitals, you're in smaller community hospitals, you're in regional healthcare facilities, to start to apply some of the principles around AI, responsible artificial intelligence, and the associated data uses and responsible data uses. So it's really interesting to see that if we, thank you for the poll, for those who have responded, what we see is that there is, half of you that are already implementing or thinking of implementing an AI-enabled solution. So you're really coming to this webinar to learn the how-tos. And then there are 64% of you that have zero experience in implementing AI solutions, but you're coming to learn more, with 32% of you that have some experience in this, 0 to 1 year. So a really great indication of who the audience is and where we're really targeting. And in fact, that's exactly where this toolkit targets. It targets those who are curious and interested and sort of motivated to get involved in finding different mechanisms to support better patient outcomes and more efficient health solutions. Throughout this journey, we have been talking about a number of different topics. We have looked at issues of what is AI and how is it being used in healthcare in Canada, really trying to anchor it in the Canadian context. We've been looking at some of the main risks and benefits associated with the use of artificial intelligence in the health sector in Canada. We've also looked at both existing and emerging as well as pending law that touches on aspects of artificial intelligence, in some cases specific to the healthcare sector, in some cases broader than that, but that will come to bear on this sector in particular. And now we're at the point, the last 2 webinars in particular have really been at the point of talking about some of the tools that you can use to implement, to actually get started. One of the questions we had at the beginning that we know it circles around a lot is, well, what do I do? Like, I've got great ideas. I have no idea how to actually get started. So this is really what this particular webinar is going to be focusing on. We are going to be talking about good governance of artificial intelligence. And if you were joining us for the first and second in particular, those 2 webinars, you'll know why we care about this as a distinct and unique question. So artificial intelligence does bring, in the way that it is constructed, in the massive amount of data that it consumes for training and in some cases ongoing deployment purposes, in the types of outputs that are created, the fact that there is an analysis of trends, it informs predictions. It certainly supports decision making, depending on the use, of course. That these systems bring a lot of potential benefit. They can certainly crunch a ton of data very quickly with generally fairly accurate and reliable outputs or predictions. So that's really important, particularly in the health sector. But there are also some really notable risks. And I would encourage you to look at the last webinar we had with Janet Guevara from Infoway as well, where we unpacked some of those risks. Now it's about what do we do? So how this module in particular looks at some of the key components with AI governance, and really tries to institutionalize and assist in the creation of tailored governance processes for your particular organization. So what we've constructed are some of the building blocks that you can use within your own organization to create a more effective and tailored, certainly a responsive program that allows you to hopefully maximize the benefits of these technologies while minimizing and mitigating risk. The audience is the audience of this particular module is really focused on people within the healthcare organization that are working on different aspects of AI development and delivery. So you don't have to be an engineer or an IT staff member to value this particular webinar. In fact, we're targeting those that really have an interest in the administrative safeguards that are often put in place, like the policies, procedures, and the different accountability mechanisms. And the objective is really to enable informed and strategic discussion about responsible artificial intelligence within your organization. The world of AI governance is broad. It's very fluid. There is a lot coming out that gives guidance around what it means to sort of do good AI. And how to be responsible in the control mechanisms that are put in place. What we have proposed are a series of guides that will support 3 particular areas of a broader AI governance framework. So the 3 areas are people, policies, and procedures. We are in no way suggesting that this encompasses the entire world of an AI governance program, but simply to say, here are some of the key issues that we see coming up and the key areas of investment for AI governance. And we'd like to offer some guidance in those specific areas. So when we look at those 3 umbrella topics, if you will, we break each of them down into specific guidance areas, and we're going to cover these specific guidance areas that you see in the right-hand column. So we're going to look at a higher level, sort of committee, an AI governance committee, a mandate, transparency and accountability, automated decision systems, vendor assessments, risk assessments, and then data testing and data monitoring. We have to cover all of this in about 40 minutes. So we're going to get going, but it's a lot. So you will find it a bit high level. And I encourage you very much to go back to the toolkit and have a read for more detail, and then take some of these proposals, some of these thoughts, and really bring them into your organization to see how they could be used and tailored to your specific needs. So getting started, we wanted to talk about the AI Governance Committee. And no doubt the first thought going through your mind is, what is she talking about? What is an AI Governance Committee? I have never heard of this. It's okay. AI governance, I want you to always think about the infrastructure and the capabilities you already have within your organization. I am almost 100% positive that each of you within your organizations has a data governance committee or some data privacy risk committee that's in place to support responsible data use. Well, that's one key component of AI governance. It's not the whole thing, but it's an important component, and it's one that can be leveraged to build a broader AI governance committee. So what this particular committee is looking at, it's sort of the entire life cycle of the AI system from and the AI program from the data through to the outputs, and then ongoing monitoring and iteration of those systems. So the key function of the committee is to provide that comprehensive and coordinated review of various systems, to look at how these systems, these AI systems, may be used, and to certainly flag particular topics and issues that may be of concern. Issues like, have we given sufficient sort of ethical rigor, rigorous considerations over the data, as well as the system, as well as the use case? Have we really thought this through? Do we need to bring in different stakeholders to feed into our overall process of this particular system? Do we have the right training in place so that everybody understands what they're participating in and how they need to use these systems? So that's one component. Do we have the right controls in place to ensure that the system is doing as intended, and that it's not sort of adapting and changing data environment? So really important to have some kind of oversight in place. What we're finding as more and more AI governance and AI risk management structures are coming up in different policy circles is that the notion of accountability is unsurprisingly extremely important. So this AI governance committee will provide some aspect of that. Another point is really to have that strategic foresight. So a group of people coming together from different parts of the organization to think really strategically about how the overall AI agenda of the organization is going to look, and how it's going to connect to other key parts of patient, healthcare delivery, patient care, system efficiency processes. So we've always said from the beginning, at no point is Infoway suggesting that AI is the be all and end all of all solutions. There's no push necessarily to implement AI enabled solutions. This is here for those who are interested, that they can, pick up the toolkit and start to learn what they need to do so in a responsible manner. The other part that's really important is the external and internal engagement. Stakeholder engagement, particularly where you have systems that will be interfacing with vulnerable groups, is a key component to responsible and ethical AI. And it's something we'll look at a little bit later. You will hear a lot about AI ethics. It's an area of study that really looks at the use and the impact of artificial intelligence systems, given that they are such highly complex systems, and that they, as a result, some of the outputs can be highly persuasive, even if not particularly well understood. There is an entire body of work around what does it mean to create ethical systems. Interestingly, earlier this year, during the Oxford debates, there was a question put to an AI that said, can AI ever be ethical? And the AI system, in the form of a robot, answered, no, we can never be ethical. And it certainly raises a whole bunch of very interesting questions. But what it doesn't do is negate the point that those individuals who are conceiving of ideas, sourcing different data sets, building AI systems, operationalizing those systems, and monitoring those systems certainly can be ethical, and ought to apply that lens to the overall life cycle of the system. Ethics is an area of study that's getting a lot of attention, not only from academic circles, civil society, industry groups, but particularly from policymakers and legislatures, that as they look to start to regulate elements of artificial intelligence, they are looking at components of ethics. So in particular, you will start to hear more of the concept of the impact assessment or the conformity assessment. The impact assessment really focusing on, as we actually do in the privacy context, when you think of the privacy impact assessment, there is an emerging area of the AI impact assessment or an AI risk assessment. They're a little bit different. I won't get into the nuance. Happy to address that on the podcast. But but certainly the two ideas are coming forward together. And the concept of the impact assessment is to really think through those foreseeable harms and try to mitigate those foreseeable harms as much as possible. And so building out this organizational awareness around AI ethics, building in that data literacy that you've heard me talk about time and again throughout these various modules is really important in operationalizing AI ethics. It's also really important in establishing a sort of baseline of knowledge within your organization about what is AI, what are AI ethics, why are they important, and what is the organization doing to walk the talk when it comes to AI ethics and responsible artificial intelligence. Another area that you are hearing a lot about, and certainly you have heard throughout the course of this webinar series, has been around the concept of transparency and explainability. And I'm going to distinguish these concepts for you. And some may agree, some may not agree with the way that I distinguish. If you don't agree, I'd actually love to hear why, either in the Q&A or on the podcast, or you can reach out to me separately. But, you know, when I think about algorithmic transparency, I'm really thinking about this ability to understand what's happened in a tangible, practical way. So how the system is operating quite practically. And then explainability is an area where we're trying to deconstruct how the system worked. So it's a slight nuance, but taken together, it's about, do we enable people on the receiving end of the output, and I'm choosing my words carefully here, but do we enable those who are on the receiving end of the output to understand how the output was formed? Meaning, if the system produces a particular prediction, is it understandable why the system produced that particular prediction? And if not, then what are the implications of that? So we see this in the context, for instance, of an AI system used to assist in diagnostic outputs or diagnostic processes, where whoever is on the receiving end of the output, if it's a clinician in particular, needs to have some degree of sort of trust in the output of the system, and where there needs to be a challenge of that system, that there can be a challenge and that there can be some kind of meaningful explanation about what happened to render that particular output, so then we can exercise sort of human judgment over that output and decide whether we want to follow the prediction or take a different course. This is really important. It's also important when you think about trying to exercise your rights over that output, particularly in the context of an automated decision system. We're going to look at automated decision systems in a second, but at a very high level, just as like a bit of a précis, the automated decision system is a system that assists or replaces human judgment in decision-making capabilities. And in the healthcare context, where we are on the receiving end as a patient of an automated decision system, even where there may be a human in the middle that helps to interpret, we may choose or want not only a deeper explanation, but in some cases, we actually might choose to contest that output. And being able to understand how the output was formed, what are the variables that affected and that ultimately resulted in that particular output, is critical to that explanation. What I want to highlight in this particular area is that, and I might actually just turn here to do so, when you're unpacking some of the questions that need to be asked when we're trying to develop our explainability policy and our explainability procedure, in addition to our explainability criteria. So I've just given you sort of 3 deliverables within your organization that I would love to see the AI committee drill down on and ultimately produce: the policy, the procedure, and the criteria. When you see that, you will find that the questions that need to be asked have to do with what algorithms were used, how does the system work, what influences some of the outcomes, or you're hearing me use the word output a lot, so what influences some of those outputs, how could the outcome be different, so what could change at the outset or within to ultimately change that output, how do we know the system is reliable? So what are some of the verification mechanisms that are in place to help give us that sense of comfort that the system is in fact reliable?
So these are some of the questions that we need to really think about and consider as we provide sort of that policy, that guidance over explainability. Oops, went too far. Okay, the next has to do with guidelines on automated decision. What we're finding here is that the law is starting to identify what and define what.
Hi, Carol. Carol, sorry to interrupt you. Your audio is just a little muffled and cutting out. Are you able to just adjust your mic? Yeah, it's making it very difficult to hear you even right now.
How's this? Is this better?
Perfect. Thank you.
Thank you. Thanks for letting me know. So guidelines on automated decision systems, we're seeing more and more that governments and legislatures are helping us define what an automated decision system is. And there's actually quite a bit of focus on what I'm going to refer to as just ADSs. And the reason for this is because an automated decision system is a system that ultimately has a direct impact on the individual, or can have that impact on the individual, and it influences the way we think and the way we make decisions. And so in this particular context, there's more regulatory concern around how these systems are developed and, frankly, how they're ultimately governed. So very quickly, we see that an ADS is a computer-based algorithm that can be used to assist or replace the judgment of a human decision maker. This definition draws inspiration from Bill C-11 that was tabled in November 2020, and that was supposed to reform federal private sector privacy law. It died on the order table when the election was called, but it's still a definition that we draw from, because actually it's also included in the Treasury Board guidelines and the directive on automated decision systems. So we really draw inspiration from that definition. And you'll see that it's also given a technical definition that's very, very broad. So it says it consists of rules-based systems, regression analysis, machine learning approaches, and a wide variety of other statistical approaches. In the Bill C-11 draft, it said it included neural networks. So very broad definition that, just to put you on notice, this is what constitutes the automated decision system at a high level. And some of the guidelines around making decisions and putting controls in place for automated decision systems include, have you thought through transparency issues? Have you thought about explainability? So when is explainability required, and what is the level of explainability that's required? Disclosure notices to individuals so that they know that they are interacting or that they are the subject of an automated decision system. This is becoming very important, particularly if you think about Quebec's law that is now it will come into effect by the end of the year, or at least parts of it. So, have you put in place those appropriate disclosures that would allow somebody to contest if they don't want to be part of the automated decision system, or if they want to challenge the function of that system, challenge the outputs? Has there been appropriate peer review and audits of the system to ensure it's operating as intended? Is there any form of human intervention by a trained expert who can understand the output of the system and provide an important translation function to, other stakeholders that may not have that same level of expertise? Is there a right to recourse of the automated decision system? And what particular position is your organization taking with respect to different risk levels of systems? So should some systems be the subject of a right to recourse, whereas others should not? What decision are you making on that? And then also importantly, what are some of the training opportunities in place for automated decision systems? Moving over to vendor assessments, and again, I do appreciate that there's a lot that we're covering here in a very short period of time. So I'm whipping through this a little bit, but we will get to Q&A. So we've covered explainability, we've covered operationalizing AI ethics, we've covered the AI governance committee, and we've covered now automated decision systems. So we want to turn to some of the procedures related to the vendor interaction. Well, we talked about this a little bit, I think it was 2 webinars ago, where we said, increasingly, particularly in smaller organizations, the likelihood that you will be building sophisticated AI systems in-house is relatively small. Rather, the expectation and the greater likelihood is that you're going to be retaining, hiring, external providers to provide particular solutions where you can potentially co-create aspects of the solution, or you'll simply buy it sort of as an out of the box type solution. In which case you really need to be thinking about how you're going to reform and maybe augment your vendor assessment to ensure that you've got the right relationships in place and that you've thought through the risk associated with those vendors and mitigated those risks in a responsible manner. So usually we're saying, the guidance that we're about to look at should be used when assessing a new vendor, or if the vendor is offering a very new solution that is AI enabled, ask some of these questions. That's a material change to an existing vendor relationship, and then really helping you take into consideration some of the risks associated with the benefits of that procurement. Or will you look at maybe augmenting internal talent so you can bring that risk in-house and manage it differently? Some of the questions, we've got 2 slides of sample questions that we want to go through, but I would very much encourage you to look at the module itself, because that will give a little bit more context for you and hopefully will be helpful in elaborating some of these questions a bit more. But some of the questions that we're looking at, for instance, include, does this vendor have a particular commitment to responsible artificial intelligence and responsible innovation? Can you look at the general supply chain of that particular vendor, if there is one, and is it aligned with your values? Do they have a sort of diverse and multidisciplinary team that can support a broader perspective and really help inform that perspective on the system itself? As well, what is the nature of the technology that they are proposing? Does it fit the automated decision system definition? If it does, then you might want to consider some of the emerging regulatory requirements that would be coming into place if these laws are ultimately passed. So really trying to plan in advance and really trying to think about, who is this vendor? Are they likely to stay for a long time? Like, are they a well-established, well-reputed vendor? If they're newer, there's no problem with a newer vendor. You just want to, again, do that diligence and make sure they've got the right security systems in place. They've given it they've given their system an appropriate assessment. They've been diligent in the way they've built their systems. They can justify their data sources. I know, again, I'm throwing a lot at you. But these, again, look at the module and please, consider some of these questions. Also really important is to consider questions around data access, data sharing. In all likelihood, the vendor will retain full ownership of the solution and will likely ingest your data into the solution to modify and improve their algorithms and then offer you the insights and the outputs. This isn't 100% of the case. They might provide a very valuable on-prem solution, but you will find more and more vendors coming to you and asking for that. And you will undertake, no doubt, an appropriate PIA, privacy impact assessment, associated with this initiative, as well as likely an AI risk assessment that we're going to look at next. So you want to start asking about some of these questions related to, who is the vendor? Who do they have people on staff that can help interpret for us and explain to us where we need training and we need greater expertise? Do they have an accountability framework in place? So have they demonstrated a commitment to ethical AI such that they themselves as vendors have put in place appropriate policies, procedures, and controls over their own system and their own processes? That's really important. And it should be something that you are comfortable asking so that you can document that as part of your own diligence process. As well, does the vendor have a particular knowledge transfer plan in place to ensure that your organization can effectively use the tool on your own, and to provide any type of training for any member of your organization that might need it. Turning now to guidelines on AI risk assessments. So I want to pause here because I've used a word seemingly interchangeably when it comes to these assessments, AI assessments. I've called it both an AI impact and an AI risk. And I just want to be clear to distinguish the two and let you know that there are two that you are likely, they can be integrated, but there are two frameworks in your mind that I want you to be thinking about. So first, let me contextualize what an AI assessment is and why they're conducted, or increasingly it's being proposed that they be conducted, and then distinguish the risk from the impact. So an AI assessment is really a thoughtful exercise, very similar in process to a privacy impact assessment, if that's familiar to you. It's an exercise to think through how the system is going to be used, and then what are the risks associated with that system. And when we talk about risks, we're talking about from beginning to end. So we're talking about the system, the data set that the system is built upon or trained on, the use case that it is contemplated for, so the intended purpose of that system, the entire training process, how it was trained, and then the outputs that can be expected, and what are some of the verification mechanisms that are in place to help give you comfort that the system is operating as intended at a level of reliability and accuracy that you're comfortable with and you think is justifiable. And so we conduct a risk assessment to really understand where there are potential issues, there are potential risks associated with the design and development and deployment of that system. And then we do an impact assessment, which really considers the stakeholders. So what is the use case of the system and who is likely to be impacted by the system and how? I say who, but it actually sometimes could be what. So who, meaning who are some of the individual stakeholders that might be, and it could be patients, it could be families, it could be clinicians, it could be staff members that are likely to be affected by the system. Or it also could be other things like, is the system expected to have a big impact on the environment, for instance, and given how energy consuming some of these systems are, that might be an impact that's factored in by your organization. Is it possible that there are physical harm impacts to property? For instance, if you're going to be deploying sort of an AI-enabled robot that could potentially have an impact on property. That's just an example of how we really want to think through the impact, not just to individual, but to other aspects that may be applicable as well. And so we start by looking at some of those risks to see, just as a baseline, what does the AI system do? What are the known and foreseeable risks and foreseeable harms associated with that system? And then what are some of those appropriate measures in place to mitigate those risks? I do want to flag for you something that Janet said last module when she talked about the BC and Yukon privacy commissioners that co-authored a report in which both called for a joint PIA and AIA, so an algorithmic impact assessment. They're not the first, but they are, that report was fairly clear in requiring or seeking to have a joint PIA and AIA. So it's something that I can anticipate coming down the pike. In the next few years, we'll see this more and more as, and then over time, I think it will just become the norm, but more and more as the requirement that there is a joint PIA and AIA that's conducted for any new major initiative. I will say also that in different jurisdictions like the EU, where they have draft Artificial Intelligence Act, that's what it's called, the AIA, Artificial Intelligence Act, that they are specifically proposing an AI impact assessment for all high-risk AI systems. So you're going to have to do that risk assessment to determine where on the spectrum, if you're in the EU context, which I could see us starting to borrow some or draw some inspiration from. You'll have to do that risk assessment to determine where your system is on the sort of the risk spectrum, and then undertake an impact assessment to really try to unpack what some of those potential impacts are and how they can be damaging, and ultimately how they can be mitigated. So one of the last major issues that we're going to cover are guidelines on data testing and data monitoring. If you ask many people in this space, they will say it is all about the data. Know your data, understand your data, assess your data, validate your data. And so these are just some guiding questions, but really this is to spark a conversation with your IT and data teams to unpack what some of those specific questions are in your organization that you want to make sure you're asking, or you want to make sure your AI governance committee is asking in particular. And they cross over. In some cases, they're sort of drawing inspiration from the privacy world, from the security world, but also very much from the AI world, and specifically AI ethics. So data collection practices, some of the guiding questions have to do with data provenance. Can you track the data, the origin of the data? Do you know where it comes from? And certainly the labeling of the data, the intended purpose of how the data is to be used. The data risk assessment. So this draws from the question of whether there are proper data quality assessments done, recognizing that there are no specific universally accepted data quality standards for PHI in particular. So there are decisions that have to be made sometimes within your organization as to what an appropriate standard is. What is the baseline for good quality data, and how does that change depending on how it will be used? And then unpacking some of those indicators of good quality data, and how you will be demonstrating your compliance with those standards, whatever you choose within your organization, how you'll be demonstrating compliance with those standards, what criteria you'll hold your organization to show that you have really been thoughtful about the data set before you go ahead and share it or use it. There's also model testing. So questions around determining how to measure the performance of the model and documenting decisions of the performance. So making sure the model is operating as intended and that it doesn't start to operate in an unintended fashion. If so, what are some of the steps that need to be taken to limit that change in purpose? Are there particular audit logs that will be put in place? I think the answer is yes. So what do those audit logs look like? How often are they maintained? Who owns those logs and how are they reviewed? And then what are some of the capabilities for the logging to ensure a high level of traceability of the system's function? So really trying to maintain control over the system to ensure it's operating as intended. As well, coming back to these issues of interpretability, can we understand the results? So not only are they explainable, but can the layperson just understand what is intended by these results and what we can do to better equip and empower those on the receiving end of the output to know what to do with those results? Accountability. What does the broader AI governance framework look like within your organization? How have you internalized some of these lessons to try to create a sort of an infrastructure and architecture around AI governance and AI ethics? What are the principles that you will anchor your responsible AI governance program in? So what will that look like? And that's really a values discussion more than it is anything else. but it also serves as a really important accountability anchor, an accountability goalpost, because when you've got these principles that are in place that you all rally around and align to, then sort of drawing out that broader program becomes a little bit easier, and certainly reporting on that program becomes a lot easier. An important issue has to do with obviously recourse and an ability to object or contest what you're hearing. So you've heard me talk about this before, but the idea that there is some element of recourse, and that, whether it's clinicians, it's staff, it's patients, it's families, that they have an ability to really understand how the AI system has produced an output, and then ultimately to change that and to, have some kind of impact on that or influence over the output is important. And then again, we've got interpretability twice, but I think the last one was really going to be explainability and being able to do data testing and data monitoring for the purposes of ultimately creating a system and some guidance that supports explainability. With that, that really summarizes the core of what we've been talking about throughout Module 6. And in particular, really trying to assist in identifying areas where you in your organization can play a lead function and start to mobilize the organization to better identify data sources, talents, opportunity, and then ultimately use cases that could be beneficial. And for you to be able to play a leading role in your organization around some of these great ideas, hopefully also sharing them with Infoway so that we can track, and Infoway can track, how artificial intelligence is starting to flourish in the health sector in Canada. We see a lot happening around the world, and the reality is there's a ton happening in Canada as well. So being able to get all of those different pieces and showcasing the real value that Canadians bring to our own healthcare sector is really valuable. So throughout this series, we've talked about different concepts of artificial intelligence and its practical uses in healthcare. We've explored, of course, the benefits and the risks, some of the risks associated with the use of AI in healthcare, trying to give the same airtime to both benefits and risks, because we do see some great benefits in the use of these technologies in the health sector in particular, particularly our health sector. We've provided an overview of emerging legal and regulatory issues just to help sort of frame your thinking around compliance, but also to frame that AI governance piece that we're ending on here, to give you some of those indicators as to what's coming down the pike, so that as you build out some of these programs and some of this infrastructure around AI governance, you know what to align it to and why. Certainly considering policies, people, and processes for your AI governance program, which we would love to hear about as well. And then ultimately to propose a suite of AI-specific policies and guidance for you to lead in your organization. With that, I will close and open it up to any questions. I know, again, there's a lot to take in, but we'd love to hear from you and some of the questions that you may have about the proposed guidance, as well as anything to do with AI governance. Thank you.
Well, as usual, fantastic, Carol. Great having you on the team there, helping us out with this. Lots of questions and comments today. I thought, though, because this is our last webinar, I'd maybe just take us through a little bit of how we got here and what it all means, and what we were thinking. Infoway started looking at this when we spent some time with the Canadian Institute for Advanced Research, CFAR, and a report they published called the AI for Health Task Force. And among other things, they were looking at how to accelerate the adoption of artificial intelligence in healthcare. And this is really what we've been focusing on here, working with organizations like the ones that are represented here who are just starting down their AI path. And we wanted to give a handful of tools to give a little bit of confidence, put a little bit of air in organizations' wings moving forward. With the webinars we've covered the high level pieces of a lot of this information. We have more detailed information in the toolkit, aspects, and people are asking for more information. So there's more information in the toolkits. But we also know that this is not enough. Like there's a lot more to do. And some of those more things we can begin to think about. We're actually just going to launch a poll in a second asking your idea on further topics and how you would like to receive this information. But the other thing that I think you should begin to think about is, how would you go about beginning to put together an AI assessment within your organization? And how would you want to add on to your privacy and security and risk assessments that you're already doing? Infoway and our toolkits and our webinars can only take it so far, but somebody like Carol and her group, they could really pick the ball up, I think, and help tool this moving along. So that's something to think about. We're really interested in, do we want to keep with the topics we have and get more detail? Do we want to get some new topics? Is this the right forum and format to deliver information? We're wide open as we're moving along. So that's the first part. The second part is throughout the 5 webinars, we've never been able to answer all the questions that were asked. And one of our intents sometime in the next month or two is to pull those all together into one more podcast, one more webinar where we're going to try to get through them all. We'll see whether that's possible or not. And don't be shy about asking more questions as we're going along. And if you can answer, some of the poll questions, that would be quite helpful for us. Carol, a question for you while we're wrapping up. Could you just talk about, as you were presenting and thinking about the toolkit and thinking in particular about this AI assessment that I'm imagining most people on the call today, on the webinar today, haven't done. How are they similar or different from an AI or from a privacy assessment or security assessment or a general risk assessment? What are the differences there?
So it's a great question because some of this we can answer and some of it you have to make up, not invent entirely, but you really need to do some research to figure out what is going to work as a good assessment for your organization. Let me just start with the process. So if you look at a security assessment from its rationale through to its intended use, or you look at a privacy impact assessment in the same way, you'll see that you're trying to identify, number one, you're trying to document what is happening, like what is the current state, right? Just explain what's going on. So in a PIA, we always want to know what's the data flow, who are the players, what data is implicated. That's the first set. The second thing you're trying to do is align and do an analysis within existing law. And so, in the privacy world, we're always looking at the applicable privacy law. It's a little bit different from a security perspective. So I appreciate this might be a little bit more specific to privacy, but this will start to come to bear in the AI world as well as law starts to develop, which it will. The last part of this assessment is looking at really thinking through risk. Right? And you're thinking, I really want everyone to understand that you're thinking about risk and impact. So you're trying to understand in the AI context, what are some of the risks associated? Like how can things go wrong? And then how will this impact individual stakeholders? And have we properly identified those stakeholders? So the process that we go through for a security assessment or a PIA, we will take that general flow and bring it into the AIA as well, where we're trying to understand what is at play. We're trying to do an analysis within the existing sort of legal policy context, and we're trying to identify foreseeable harms and mitigate those risks and harms. That general flow is what you'll find in an AI risk assessment. However, the specific questions that you're asking will differ. Because when you're looking at an AI assessment, you are really thinking about the specifics of the specifics of the system. You're looking at the use case. How is the system going to be used? Is it going to be used to support the identification of a rare disease in a patient population? Is that the case? If that's the case, then we're going to, that will help us identify who are the stakeholders that need to be involved, who's the receiver of the output, and how will they be trained or using the system. How explainable is the system given that it's used in a diagnostic capacity or function? And you're going to be thinking about what is the data set that was used in this particular system, and how could it potentially be biased, unintentionally biased against specific groups. How robust is the system? How secure is it? So this involves elements of cybersecurity for sure, but it's also looking at how reliable is the system, and how likely is it to veer off its intended use, its intended purpose. So those are some of the key elements that you find in an AI risk assessment, but this isn't written in stone, right? This is an area that very much is evolving. So there is some room for creativity, if you will, but I'll actually frame this a little bit differently. There's room for expertise. So this is where you want people who understand the implications of an AI risk assessment to inform what your template looks like, and then to help do training on how to appropriately implement that template.
That's great, Carol. And, I think a lot of the questions that we had today were, how do we move forward with this AI assessment viewpoint? And some of the questions are related to, okay, if we do an assessment, how do we evaluate the answers that are in the assessment when somebody's coming through? And what I picked up from what you're saying is we're kind of in the early days of understanding what this looks like.
Yeah.
Hospitals have very mature privacy assessments. I mean, most Canadian hospitals know what to do with that. I'm imagining this took a decade or longer to, come up with what that looks like. Could you talk about just the arc of what AI assessments might look like over time?
I don't think it's going to take that long. I really don't. We're becoming much more data mature. So the concept of trying to think through this process is something that is a little, as you say, I mean, in hospitals, it's a very mature process. And you're taking the privacy process and you're adapting it to AI. What it needs at the beginning is a bit of expertise. So internally, if you have people who can, who understand the general rubric of responsible AI and can help inform what that assessment should look like, that's fantastic. They will be the ones at the table to help through this process. And then absolutely, it will be iterating based on new policy guidance, new best practices, internal best practices, and I would argue emerging laws. Because I think we will, even if we don't see a ton happening in the legal space in AI, I think we draw inspiration from other jurisdictions as well. Because as we've seen in the privacy context as well, I mean, there are certain fundamental principles that transcend borders. So I would look at other jurisdictions just to see where we can draw inspiration. So I think the assessment will be exactly that. It will be a combination of expertise, augmenting existing mature practices to do with data, and then iterating as needed.
Thanks, Carol. So look, let's wrap this up. If you haven't already looked at our poll, look at our poll. We didn't get to all the questions. Thanks to Rula, thanks to Anonymous for a few more questions. We're going to try to get to those in another forum a little bit later on. We're not going to lose them, and we're going to do our best to get them answered. I want to thank Carol again for helping us with this. This toolkit has really hit a really nice spot for Canada in healthcare. Lots of interest in it, and we want to build on that momentum. And thanks to everybody who's attended. And with that, I think we're at the end of the seminar today, end of the webinar series. And thanks so much for attending. And look for more from Infoway and from Carol and the whole team. So thanks a lot, guys. Bye-bye.
Thank you.